Hello family, welcome to Dr. Brumfield's Elite Athletics. I am Dr. Brumfield. If you're new to the channel, we would like to say welcome. If you're returning, we would like to say thank you for the support, and we hope we've added value to you and to your condition and your families. And so what we want to talk about today is, and I don't know why it just got dark in here, okay? Sun's going down. What we want to talk about today is heat versus cold, right? And we want to talk about the common mistakes when we're dealing with this. And so both are very important when it comes to your injury or just healing in general. And so one of the things that we need to look at is, one, what does heat do or does versus what does cold does or do? I don't know why I'm tongue-tied, but hey, we're gonna roll with it anyway. I already pushed record, so let's make this happen. So one of the things is with heat does what we call vasodilation. Ice does what we call vasoconstriction. And so if you will, I'm gonna give an example of what these two are simply by using a local sponge, a simple household sponge. If we take that dry sponge and we place that sponge in water, what's going to happen is vasodilation, right? That means that the sponge is going to absorb all the blood, the sponge is going to absorb all the water, right? And it's going to become filled, right? So all the pores of the sponge is now open. Now you got water flowing completely in, and it's just going to keep flowing, and it's going to keep flowing, it's going to keep flowing, right? That is what we call vasodilation. Now, on the other hand, we take that same sponge, and now it's been vasodilated, it's full of water, right? Now what we want to do is we want to vasoconstrict, which means we want to kick all of that water out of there, right? So how do we do that? We squeeze it out, right? We squeeze, we wring it out, and as we wring it out, what happens? The water drips down your arms and it's all onto the floor. And now if as you squeeze it long enough, then the thing that happens is that the sponge now becomes, water free, right? That is the phenomenon behind vasodilation and vasoconstriction. So we're talking about our veins here, right? We're talking about the blood that's moving through our bodies. And so what happens is, let's say we have an injury, right? And so we have to determine which modality, meaning hot pack or cold pack, are the best to use. Now, they both are beneficial in the usage, but timing is important when you use one over the other. And in fact, if you pick the wrong one, you actually can make your situation a lot worse than what it could be or what it should be. And so the other thing that we need to talk about is an acute injury versus a chronic injury, right? So when we're talking about an acute injury, we're talking about an injury that just happened to 3 days. We're talking about 0 to 72 hours. That's considered a acute injury. And so what I like to tell my patients, in case they forget, sometimes your little Timmy falls down and gets a little boo-boo. And so parents, we're not going to remember, right? So 72 cubes. 72 cubes should remind you that for the first 72 hours, I'm using ice. That's it. So anything that falls outside of 72 cubes, then we know we're using heat, right? Okay, so why is it important for the first 72 hours to use ice? Well, once you injure, let's go back to little Timmy. So little Timmy got a boo-boo. Well, okay, we'll keep with little Timmy. So little Timmy has a boo-boo, right? And so with that boo-boo, now let's say he banged up his elbow, or he sprained a finger, and I'm pointing to my ankles, right? I don't know what's going on with me today. He sprained an ankle or something like that. And then, so what happens is the body has its natural inflammation response. And so there's 5 things that we need to look for when we're talking about the inflammation response, because really that's going to decide whether we're going to use heat or whether we're going to use ice. And so the first thing is redness. We know that there's an injury there. He sprained his ankle, or little Timmy got a boob on the elbow. So the first response in the inflammatory response is redness. You got the injury to the insult to the body part. I'm gonna get through this whether or not it's right or wrong, but I'm gonna get through this. You got the injury to the area. Then you have the heat. So as the injury has occurred, now you have blood flowing to the area, right? And because basically the blood wants to protect and it wants to heal that area, it's sending in blood healing cells that's going to kind of eat up all the bad stuff and start the healing process. But in that, you also get the swelling. So now you got the blood again that's influxing in, because what's happening is called by an accumulation of injury. And so that blood is just going to keep pulling, taking out the bad blood, bringing in the new blood, and then the pain is going to increase, right? As the pain increases, that's letting you know that something is wrong. And then as you know, as you sprain an ankle or whatever, then all of a sudden you lose the loss of function. Those are the 5 signs of the inflammatory response. And so it's important that in the first 72 hours that we do not use heat. So I'm going to say that again. In the first 72 hours for an acute injury, heat is the last thing that you want. Because as I've already gone over with the 5 stages of the inflammatory response, we know that blood and all kinds of other nutrients are headed to that area already. So if we add heat, and we're going back to that dry sponge that we placed in the water, then we know that vasodilation is going to open up the floodgates. So now the body is already adding blood to the injury, right? Because that's part of the inflammation response. Now we are also adding heat, which is a natural vasodilation as well. So now you're compounding your inflammation to be even more, right? And so even in the clinical settings, I can always tell when a patient comes in, I get that phone call, Dr. Brumfield, I can't walk, I can't move. This is the worst feeling that I've ever had in my back. I don't know what's going on. I may need surgery. I ask a simple question. You put heat on it last night, didn't you? And they go, yeah, how do you know? Because heat on an acute injury is bad news. All right, so what we're going to do right now is I have a patient here, Michelle, and we're going to demonstrate actually how to apply the heating pad, cold pack, and all the other good stuff. All right, so the first thing that we want to do, let's say Michelle is having back pain. So we're going to have her to raise her legs and go ahead and just lay your legs down. And what this is going to do is actually take the pressure off the lower back. So when we talked about the heating pad, one thing that we want to always do is have a layer of tiling. So let's go ahead and sit up, Michelle. As she sits up, we're going to put a layer of tiling in over the heating pad. One for right now. Now this is an artificial heat in terms of, having the heat to penetrate into the body. Go ahead and lay back. Now, what I don't recommend is this. For heating pads, you don't want to lay directly on it like this because you could fall asleep, because you may not have an auto shut off. So this will actually end up burning you. So what I prefer is to have the patient to lay over on their stomach. Let's get you up. Let's turn you over on your stomach. We're going to move back. Uh-oh. Drop your phone. That's okay. Go ahead. Go ahead and lay down. And this way, we'll do it the same way. Layer of toweling, and then that way it's placed correctly on the lower back. So as you see there. So drop in the contact box which modality you would use the most. Do you use ice or do you use heat? Now, there are some times where heat is preferred more than ice. Arthritis, let's say you have an arthritic knee, heat is going to generate a lot of relief, right? Because it's a chronic, although arthritis is a chronic injury. So you see the pattern here. So, drop us a note. What do you prefer? Ice or heat? Which feels better for you? Which helps you the most? Now, make sure you stay to the end because I'm going to give you a few tips on how, a few hacks, if you will, for these different things. All right. So now we want to look at a few items, right? So here's a gel pack. Now, this gel pack, you notice it says hot, and I know it's backwards, ice pack or hot pack, but we're going to use this as heat. Now, I like these in regards to because they're clean, they're neat, unless you pop it and the gel's coming out, right? So we don't want to pop it, but you can place this in the freezer. Now, this is a form of ice pack that I like. However, it is artificial. It does get extremely cold. So you got to pay attention to it, because what you don't want to do is to create a freezer burn or a burn from it. It's not a freezer, but ice pack burn. So what I recommend is maybe a paper towel over the area. Let's say we're going back to little Timmy's elbow. Actually, Timmy hurt this elbow. So now if I place this ice pack on here directly, it's going to burn me after a few minutes. Usually you want to keep these on for about 10 minutes. 10 minutes on, 10 minutes off, 10 minutes on, which means we're going to put it on to heat up, cool off the area for 10 minutes. We're going to take it off, let the area come back to its normal temperature, and then we're going to heat it back up. Basically what we're doing is we're creating a pumping mechanism. And so what I would suggest is put a paper towel on it, and then that way you can also just let it sit there. The other thing is the area in which you place these makes a difference, right? In the elbow, there's not much skin or fat and things in protective tissue, right? Versus, let's say, the bicep, there's a little bit more. So this area can take a little bit more time with the ice, right? So we want to be cautious of that. So gel pack. One thing that I like, especially for the parents with small kids and you're new to sports and you have to figure out what's the best thing to do. So depending on the location, styrofoam cup. What I do, especially when I'm at the schools and I'm a team doctor or whatever, one of the first things I do is I go and I buy a bunch of styrofoam cups. I fill them up with water. Why do I do this? Because this becomes this becomes an ice massage, right? So let's say already that, we've filled our water up here. What you don't want to do is fill it up to the top, because you're going to have a problem. I kind of already experienced that. That's why I can show you the one that I have. Well, it was freezing, but that's another story. But fill it up to here, and bam, can you see that line? There you go. Oh, well, wait a minute. We'll get it. Hopefully you can see that line. So let's say a half pin's width. We just don't want to fill it up to the top, because as ice is going to freeze, it's going to expand a little bit, and that's the explosion I had in the back. But nonetheless, all right, so what you're going to do is when this freezes, maybe the next day or so, and let's say little Timmy's elbow again, right? You're going to just peel off the top like I'm doing here. Some of you are going to cut it off, but when you're in the field, there are certain things that you don't have. And so at this point now, you see that the ice will be up here. So basically at that point, what I can do is I can massage, you can massage little Timmy's elbow. What I like about ice, right, is that ice is natural. Ice is gonna melt. There's not a great chance of burning yourself with ice. So as you're rubbing little Timmy, then this ice is going to be, dropping down. It's going to be running down the arm. So of course, put some towels down or something that's going to collect the water, because that is a great way to go. Another example is peas. Go to your grocery store. Go to the cheapest section possible. Grab a bag of peas. Sorry, I left the peas this morning in the freezer. I forgot to bring them. Those peas are individually loose, right? And each one becomes a vasoconstriction tool. So let's say if I had a problem within my thumb, I can grab that bag of peas and it will surround my thumb without little to no effort, right? So peas are a great thing. You can also use it for ankles and just, tape around the ankles. Forget it. Tape around the ankles, or use an ace bandage. And I'm still saying ankles and I'm still rubbing my thumbs. But like I said, we're going to get through this. So, tape around the ankles, and that way the peas kind of surrounds the area that we're dealing with. Now, when we're talking about heat, it's important to use a layer of toweling, and so, which is why I have a towel. Now, clinically, they always tell us 2 layers of toweling, right? Meaning, instead of just 1 layer, instead of just throwing the towel over like this, we want 2. We're gonna fold the towel in half, and we're gonna place it on the body part. I'm sorry, little Timmy hurt this side, so let's go back over here. We're gonna place it on little Timmy's arm. So now you have 2 layers of toweling. This is to prevent the burn when we're using this thing here. Oh, this thing here, which is a heating pad. Now, heating pads are really great if you use them correctly, but they're really bad if you use them wrong. And so when is not the right time to use the heating pad? 0 to 72 hours. Now, the other thing that I want you to pay attention to if you get a heating pad such as this one. Now, this is a little larger one because I use it in the clinic to cover the whole back. I do have another one here. Now, what I want you to see is this heating pad has been used, and there's a cover that goes over it, but I wanted you to see the filaments. So you see the lines, the heating filaments, right? So this thing heats all the way through. Now, I took the cover off of this. Can you imagine if I placed this on little Timmy's arm? Right, let's say for 10 minutes, it's gonna burn the heck out of little Timmy, right? So that is the reason why we want to have a layer of toweling. Even though the heating pad that I just showed you, right, it has a layer of toweling above it, but I still actually put 2 layers of toweling because you want to create kind of a quote-unquote moist heat, right? If I were to leave this on, and it would be moist when I pick it up from the sweat, right? But you want the heat to penetrate the body part. And the longer that you leave it on, the deeper it's going to penetrate. Here's a tip though. What I don't like, especially when we're, let's say for instance, someone that injured their lower back. What I don't like about the heating pads are sometimes we put them in the bed and we lay on them. When you're laying on a heating pad, what's going to happen is you're going to have that heat to penetrate a lot deeper than what's really necessary. And so it's going to create a greater burn, and you can burn yourself easier. So what I recommend is buying one also that has low, medium, and high. But the other thing is, in case you fall asleep with it on, is to have a timer on it, maybe 10 minutes, maybe 5 minutes, 10 minutes, 15 minutes, 20 minutes, even 5 minutes. Because what you don't want to do is have this on all night because you're going to be calling me in the morning. I don't mind, but you know, you can keep yourself away from me. I tell my patients, look, you can see me now or you can see me later, but you're going to see me, all right? And so we've gone over vasoconstriction, vasodilation, the inflammatory response, right? I've gone over and shown you a heating pad, 2 different heating pads. Now I'm gonna bring this back up as well because now this also says heat. Now you can place this in the microwave for, let's say this particular one says, place in microwave container for 30 seconds, right? So once this comes out, this becomes really, really hot. But again, this is plastic. What does plastic feel like when it's hot, right? It's capable of burning. So again, we're gonna go back to the layer of towel and we're gonna go back to put this on little Timmy. Now, when do we put this on little Timmy? 72 hours and beyond, right? Okay, so I have a little hack for you guys. Let's say you don't want to go out and buy this thing right here, right? All you need are these things here. Plus this rubbing alcohol and a bottle of water. In order to make our own ice packs, and I recommend this especially for you parents with kids that are playing sports, that are coming home with the bumps and bruises, so you're going to get tired of, using ice and soaking up the couch and things of that nature. You can buy different sizes of these. For today's set example, I have this size as well as I have the smaller snack size. The other thing that you want is you want to make sure these are heavy duty. These are not heavy duty, just for example's sake. And so the ratio is 3% or 3 cups of water, or half cups, or whatever your measurement is that you're going to use based on the size. So let's say this was a large bag, right? And I want to put it on my thigh. So I'm going to use 3 cups of water to 1 cup of alcohol. And so what you would do is you would put the water in here, and I don't want to make a mess because these aren't heavy duty. Put 3 cups of water in here. Then, of course, you're going to measure it out as well. And then you're going to measure out 1 cup of alcohol. You're going to seal it up. And then you're just going to take it and throw it across. I'm kidding. You're going to seal it up. And then you're going to place it in the second bag, right? Now, once you've placed it both into the second bag, what you want to do is you want to actually lay it flat in your freezer, and it'll freeze overnight, right? And once it freezes, then you're free to utilize it, all right? So remember to subscribe, remember to like, remember to push the notification bell so that way you can get the updates when we have the next video. So family, take care. God bless. Bye-bye. God bless. Bye-bye.